What is your name and what do you do for Baylor?
I am Dr. Maxine Theriot, and I'm the Medical Director for the Baylor Comprehensive Wound Care Center at Urban Capel.
And how long have you been in that position?
I've been here since April of 2011.
Okay. And why did you apply to be a Olympic contender?
I kind of came to a point that I realized that I needed a change. And the whole, old adage that says, adage, I guess, physician, heal thyself. And I know that I wasn't in the best shape. And I wanted to get into a healthier state. I had gained quite a bit of weight. And I know that a lot of other people are also struggling with that. And as I go through this process, I knew that it would give me more accountability if I was a contender. So I opened up myself. I put out there what my weight is and heights, and when we did the initial Thrive assessment, one of the things that I noticed was that my blood glucose level, even though it was just 101, it was fasting, and that just kind of made me pause also because I have a very strong family history of diabetes, and even though that's not an indication of diabetes at that level, it's never been in the triple digits fasting before. So that also was an eye-opener around October. But I felt like my process hopefully can help others to become motivated and be consistent with pushing through. And my long-term range goals are to hopefully be able to run a full marathon. About 20 years ago, maybe a little less than that, when I was in medical school, I had trained a little bit with the running club to run an LA marathon, but because of a very busy OB rotation, I was in LA at the time but wasn't able to run it. And since then, I've just kind of petered off of doing it consistently, and so I'm starting up the process of hopefully being able to do that once again.
With a main goal being to kind of get back in the shape to run again, where are you at in that process now?
Well, I really started probably the beginning of August, where I just picked up with walking on the weekends with a group of ladies from my neighborhood, and then we ended up going to White Rock each weekend. I didn't have time, or didn't feel like I had time to go do much during the week. We would every once in a while. And then in October was when I drastically modified my diet for a short period of time, about 6 weeks. And then at the beginning of the year, through the help of my husband, which has just been tremendous, we started the exercise program, P90X. So every morning, 4:30, 5 o'clock, I'm up, I'm exercising for about an hour and a half. And that really has helped my stamina, my energy level, the whole bit. Now, interestingly, the weight came off during the dietary change. I lost about 18 pounds then. But since I've started this program and 8 weeks into the 12 weeks or so, I've only lost about 2 pounds. But the inches, I've seen that. I measured this time. So I'm seeing that the clothes are looser, that the inches are going down. So that's where I'm at right now. So it's about it's 6 days out of the week that I'm actually doing that exercise, and then on the weekends I add, going kind of lightly running and walking. I'm not to the point of being able to run even a half marathon at this point, but I'm trying to build up to that.
Okay.
So I can lightly trot maybe 5 miles continuously, but intermittently to do longer distances, walking and trotting. So that's where I am now.
Do you have a game plan, what you're going to do after that, just to keep the momentum going?
Yes, actually, because I do want to start the weight loss. I saw that within that program it has several different plans, and one of them is the P90 Lean, and that involves a lot more cardio. That would then involve sometimes twice a day getting in some exercise. So I don't know how that will work out because, again, in the evening time, that's my time to try to get things done with the family, spend time. But we'll see.
Would you say that that's your main challenge right now, is within the next 4 weeks when that's up, trying to determine how your schedule is going to handle that?
Right.
Okay.
Right. That would be a very big challenge.
As of where you're at right now, in the middle of this process, are you happy where you're at now? Are you satisfied?
I'm quite happy where I'm at. The energy level, the ability to actually get up earlier and do so much more and still get so much more accomplished because, you know, I have the strength and energy to do it. That has been phenomenal, and that's my biggest motivator right now to keep going.
Good, good. Well, and then finally, with knowing and understanding where you were in the past, where you're at now in this process, and what you're aiming for, what words of wisdom or advice would you have to somebody who's at square one where you were maybe a year ago, or at your heaviest, or what piece of advice would you say to get them where you're at now?
At some point in time, you have to get sick and tired of being sick and tired. And if it's not working, you've got to do something different. So try to find whatever it is that you think can just get you going. So if a 42-year-old woman can get on track and get back into shape, then just about anybody can do it. You know, the weight has been the biggest factor for me, but it's not just the weight. It's just been, you know, the fatigue and just not feeling well and turning some of that around. So if you can just kind of get a glimpse that it will make you feel better, then just get started and find just something to do. Whether it is a video at home that you can do in the privacy of the home, not going to the gym, or if it's going to the gym and just trying to be as consistent with that, or just walking the dog, whatever it is, just get started with something small, be as consistent with that as possible, and then, you know, build from there.